Lee Hao, I'm Bram Duffy, a paramedic from Houston, Texas, and a research fellow with the Institute for Social Innovation at Fielding Graduate University. This research presentation is titled COVID-19 and Paramedic Response, Overcategorization Concerns in Respiratory Patients. You know, the COVID-19 pandemic has really shaken up the healthcare systems across the globe, especially for those on the front line. And so when we take paramedics, for example, they've had to tackle unique hurdles because of the crisis. And one of these is having to label every patient with breathing issues as a potential COVID-19 case. And now this is tricky because there are so many different reasons why someone might have respiratory problems. They could have chronic lung disease like COPD, or heart conditions like CHF, or even issues from injuries or allergies. But each of these conditions needs a different kind of approach to the treatment. So if we're to jump too quickly and lump all the patients with breathing problems into COVID-19 categories, then we potentially miss the other diagnoses. And this could leave us to giving the wrong treatment and unfortunately could mean bad outcomes for patients. So I did a research study where we looked at 10 paramedics that had over 4 years of experience that were recruited from across the United States to participate in a recorded qualitative interview about their experiences. And the question that was asked about respiratory patients was this: how were respiratory patients treated any different before COVID-19 versus during the pandemic? And then developmental questions were also asked of the responses. All of that was coded for themes that would allow for analysis. The majority of paramedic participants recognized the fact that their colleagues and them were both overcategorizing people as all having COVID-19 because they were the first healthcare frontline contact with citizens and they had not been tested yet. And so I'd like to share with you some of the quotes that I got from the research study. And one paramedic I interviewed that I want to quote said, "I just got to a point where I didn't want to get close enough to their breathing airspace, so I stopped listening to lung sounds because the benefit did not outweigh the cost, especially before there was even a COVID shot to get." This response shows off the concern for infection and how it impacted how even the patient was being assessed. Another paramedic I interviewed that I'd like to quote had this to say: "I had patients who would be coughing while telling me they couldn't breathe, but also telling me there was no such thing as COVID. It was just wild because I was battling the war on multiple fronts. Even people who would come up to me when I'm in uniform and ask me in a condescending way if I had actually seen any COVID patients. So this kind of thing with fighting an uphill battle made me feel numb." And this sort of refers to the burnout type scenario that was influenced by public perception of the COVID-19 emergency. And then another paramedic that I interviewed, I'd like to quote, had this to say: "I think it is because the people who already had medical problems saw those problems flare up when they got COVID. And so they were having problems breathing and in denial. But they freaked out when I came into their house wearing a gown and an N95 mask because they're automatically defensive, thinking I'm accusing them of having COVID." And this really refers to how even the general public understood that they were being evaluated and looked at as potential COVID patients. The other paramedic I wanted to quote, who I interviewed, said, "Every patient who had a respiratory problem or fever is automatically categorized as a probable COVID in my head. I mean, I had a baby at home to protect. I can't care if a patient has pneumonia versus COPD or like COVID because I'm going to treat them all the same and take them all to the same hospital the same way." So this statement helps us see this responder that prioritizing the situation, but still yet fearful of infecting their baby. And so to close this presentation, I want to say that as we navigate through and beyond this COVID-19 pandemic, it's critical to learn from the experiences that show about this concern for overcategorization. And caution is necessary to prevent the spread of COVID-19, it's equally important to ensure that patients with other conditions receive appropriate care. So our goal is to look at balancing these needs and know that this will be a key feature in how we think about crises and the ongoing evolution of treating patients in EMS in the field.